Hello everyone. Today, we're diving into the world of a medication called fludrocortisone, commonly known by its brand name, Florinef. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Fludrocortisone, often recognized by its brand name Florinef, is an oral tablet that falls under the category of corticosteroids. Its primary function is to help the body retain sodium and excrete potassium, thereby aiding in maintaining blood pressure and water balance. Initially approved by the FDA, it's primarily prescribed for conditions such as Addison's disease and congenital adrenal hyperplasia, CAH. Addison's disease is a disorder where the adrenal glands do not produce enough steroid hormones, while CAH is a genetic disorder affecting adrenal gland function. Fludrocortisone is particularly effective in managing salt-wasting forms of CAH and in treating primary adrenal insufficiency. By helping the body retain sodium, it helps prevent dehydration and maintain proper blood pressure levels. Warnings: Fludrocortisone comes with its set of precautions. It's essential to use this medication under strict medical supervision, especially for long-term treatment. Fludrocortisone can suppress the immune system, increasing susceptibility to infections. It's not intended for those with systemic fungal infections. Caution is advised for individuals with conditions such as hypertension, congestive heart failure, renal impairment, or any condition that might be exacerbated by fluid retention. Additionally, those with a history of tuberculosis, osteoporosis, peptic ulcers, or certain types of infections should inform their healthcare provider before starting this medication. Before taking this medicine. Before starting fludrocortisone, several factors need consideration. Inform your healthcare provider if you're allergic to the drug or any of its components. Due to its impact on fluid and electrolyte balance, those with kidney diseases, liver conditions, or heart problems should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. Regular monitoring of blood pressure, electrolyte levels, and overall health is advised while on this medication. You should not take fludrocortisone if you have a systemic fungal infection. It's also essential to inform your doctor if you have ever had heart problems, liver problems, kidney disease, high blood pressure, or diabetes. Let your healthcare provider know if you are on a low-salt diet, have a history of mental illness or depression, or if you have any infections. If you are scheduled for surgery, inform your doctor as you might need to adjust the dosage of fludrocortisone. Side effects: all medications can have side effects, and fludrocortisone is no exception. Some individuals might experience side effects such as fluid retention, swelling, edema, increased blood pressure, and electrolyte imbalances. Other potential side effects include weight gain, muscle weakness, and mood changes such as depression or euphoria. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Long-term use of fludrocortisone can lead to more serious side effects such as osteoporosis, eye problems, like cataracts or glaucoma, peptic ulcers, and an increased risk of infections due to immune suppression. There's also a potential for adrenal suppression, where the body decreases its natural production of steroid hormones. Signs of adrenal suppression can include fatigue, muscle weakness, and low blood pressure, especially during times of stress or illness. Interactions: fludrocortisone might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Some medications that might interact with fludrocortisone include blood thinners, diabetes medications, diuretics, and certain vaccines. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking fludrocortisone. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The recommended dose of fludrocortisone for adults with Addison's disease is typically 0.1 mg once daily. Depending on how you respond to the medication and based on your doctor's advice, this dose may be adjusted. For conditions like congenital adrenal hyperplasia, the dosage may vary based on individual needs. Always ensure you're taking the correct dose and never alter your dosage without consulting your healthcare provider. Avoid: while on fludrocortisone, it's advisable to maintain a balanced diet with appropriate sodium intake as per your doctor's recommendations. Given the potential for fluid retention and increased blood pressure, monitoring your salt intake is crucial. As with many medications, it's recommended to avoid alcohol, as it can exacerbate certain side effects. FAQ. Many wonder about the age restrictions for fludrocortisone. Currently, its safety and effectiveness in pediatric patients are well established for certain conditions like congenital adrenal hyperplasia. However, the dosage and monitoring might differ from adults. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of fludrocortisone. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.